such an honor and a humbling experience to be before all of you and Victor and Sydney. I was brought to tears earlier, listening to your story. And I think, so many of us in this field have traveled upstream and become outliers many times from personal stories, and we go down these rabbit holes. I learned nothing about this in medical school. I learned nothing about it in dental school. We can go on for days talking about these issues, so I have a lot of slides and I'm going to gloss over some things, but the presentation's available for everybody to have. Basically, my history, in this field started when I was actually in medical school. Towards the end of my medical training and when I went into general surgery, one of my mentors happened to be a pediatric surgeon who was kind of nearing the, tail end of her career, and her name was Elizabeth or Betty Carrillos. And she was a pioneer in the field, and she actually developed one of the classification systems used in infant tongue ties. And it's called the Carrillos classification system. There's also the Kotlow one, which is very familiar to a lot of people. We'll show that up here. But when I was going through my surgical training program and I went into private practice, my office turned out to be across the street from hers. And she was doing scissor releases, and I was using laser at the time for facial plastic surgery and cosmetic surgery and oral surgery. And she started to introduce me to this area of tongue ties and, the term posterior tongue tie, all these weird things that everybody throws about. And that's kind of how my journey started. And then we had kids at the same time. And I didn't realize, there's no judgment about any of this stuff. My wife breastfed my first child, but she had a pretty significant tongue tie. And she's had 2 releases up to this point. She's 22 years old now and an opera singer, but it affected her. And it affected her growth and development. It affected her breathing. She's had ENT surgery. She's had a lot of things that we all talked about earlier and that Dr. Avis and Sydney went through. And it affects so many people. And I think that's the whole thing. When you look at the audience here, how many people are SLPs or feeding, by show of hands? How many OT body people? All right. Pediatricians? 1. What's your name? Vladimir. Thank you for coming, really. Because it's, we have Dr. Park, we have, the hygiene, oral myofunctional people represented, and it's, when you look at this slide here, this is kind of what we've all been faced. I don't know, this slide kind of dates me. It's from a Monty Python movie. But, we're all trying to break barriers and go through barriers or major institutional barriers. And although this field is growing, and I think in the past 5-8 years as I've been doing this, I've been watching explosive changes occur. Many of it is kind of instigated by social media. And one of the things that we've been battling is, where are we with the evidence? I get a constant, stream of questioning from my colleagues, from my dental colleagues, from my medical colleagues. Where's the evidence? It's very difficult. As it was just talked about, having double-blinded clinical, randomized controlled studies is very difficult or potentially unethical to do in these populations. You can't really take a baby that's struggling to feed and has an obvious tie and put them into a control group where you're not going to treat them. So we have limitations. We've been trying to skirt around and overcome some of those limitations, and we have research projects coming up with other ways to objectively come up with, what's going on here. And I'll present some of that, forward. Tethered oral tissues, or TOTS, is a newer acronym or term that's used at this point. And it was coined in, I think, probably at the meeting that Lisa and I maybe met at in 2013-14 up in Montreal. There was a big international meeting for tongue tie professionals, whatever that means. It was actually a coming together of professionals from all different disciplines. And that was ENTs, dentists, sleep physicians, neurology people, psychiatry, you name it, everybody was there, because we've all been kind of seeing the same things, but nobody knew. We were all so busy in our silos, and when you get into these interdisciplinary meetings, and such as this, it's a place to learn. And that's one of the things that we are always trying to do here. I as I've been going through this journey, all I keep realizing is how much I still don't know. And I, baffled each day. The number of babies and kids and toddlers and speech and feeding kids with breathing issues, orthodontic issues seems to be exploding. And there's so many little pieces of the puzzle. So when we talk about tongue ties, you talk about lip ties, and people think it's going to be a silver bullet or a magic bullet that you're going to treat this and everything's fine. It's not. It's a little piece of a puzzle. It may be a big piece of a puzzle for some people. It may be a smaller piece. One of the things we talk about, and we'll talk about the classification systems in use, and I think Victor brought that up before when Dr. Guimeno talked about mild, moderate, severe, is very damaging for many of us in this field. And I get that question all the time. How severe is this high? It's like, when I talk about mild, moderate, severe, when I'm talking to pediatricians, when I'm training and educating, I get away from numbers, I get away from classification systems, and I talk about function and symptoms. And that's the biggest thing. When somebody says it's a mild tie, I will jokingly say them, and in serious as well, it's like being mildly pregnant to somebody. It's there. What's going on from a functional standpoint? What's going on from a structural standpoint? So at that meeting, Kevin Boyd, who some of you may know, he's a very famous, he was actually dovetailed off of Brian Palmer and a lot of the work that he did with airways and understanding malocclusions and soft tissues and epigenetics, and Dr. Park will talk about some of that stuff as well. He came up with the term of tethers versus ties, or tethered oral tissues. And he tried to put that out there, or maybe get it into the medical literature or the nomenclature to kind of just maybe get away from some of the visual things that people think about with ties. Because there can be very obvious appearing ties that we can all see across the room, and there can be some less obvious appearing ties. And then we talk about, what is a tie, and what they do, how do they affect things. We'll talk some about that today. I'm not going to get into the weeds about this, but some of the common myths, that you hear a lot, that they don't exist, they don't affect breastfeeding, they'll correct, they'll grow out of these things, the kids will grow out, they don't cause feeding pain or maternal discomfort on feeding. They don't impact growth development of the teeth, jaws, and airway, and they don't affect breathing, they don't impact or cause other compensations throughout the body. Everything's connected. We're learning that. The research is starting to come out in dribs and drabs, maybe at this point. And when I talk to some of my colleagues in medicine, they'll say, "Well, this is a new thing. It's a fad." Lisa talked about that before. It's not new. And actually, if you spend time looking at the literature, there's a pretty big void in the literature looking at tongue tie releases and things like that once formula hit the market. And you can actually, statistically look at that, and that's been presented. This was a pretty routine procedure done, just snipping a tongue in the nursery before formula came into the world. And one of the things that started to happen is they would just stick the bottles in the babies and send them on the way, not realizing that they were actually causing a big generational issue with potential issues with growth and development and potential airway disorders. And along the way, things have been changing. There may have been some more rapidly changing epigenetic changes that have been going on. So there's a lot of pieces of the puzzle, and it's pretty multifactorial. But the most frequent questions we get as professionals, or when we're trying to lecture and educate about it, how do you identify these things? How do you classify them? How do you measure them? What's the damage what's the risk versus the benefit? Do you treat it? Do you leave it? So there's a lot of questions, and I still have those questions myself. The longer I've been doing this, there's still so many cases that come my way. It's like, I don't know. We don't know. We look at all these pieces of the puzzle. You guys are in a unique position because you get to screen out, the little ones. I'm in a unique position because I see neonates. I see neonates up through senior citizens. And I have feet in both fields of medicine and dentistry. And I'm in multiple organizations trying to affect change. It's not easy.